Hello everyone, so for today we're gonna talk about me. So I am Alteplase and my generic name is Alteplase.
So the Alteplase brand names are Activase and Cathoplase Activase. Alteplase therapeutic is tissue plasma activator. It is an intravenous medicine given for ischemic stroke, a stroke caused by blood clot. There are many studies shows that people or patients who receive this medication within 3 to 5 hours have better and more complete recoveries.
For my pharmacologic drug classification, I am a tissue plasminogen activator.
The Alteplase is categorized as C, in which animal reproduction studies have shown an adverse effect on fetus and there are no adequate and well-controlled studies in humans. But potential benefits may warrant of use of drugs to pregnant women despite potential risk.
For the mechanism of action, I am fibrinolytic agent, also referred to as tissue plasminogen activator or TPA.
The pharmacokinetics of the drug. The Alteplase is administered and absorbed through intravenous. It is distributed rapidly cleared from the plasma by the liver. 80% of dose is cleared within 10 minutes after infusion is discontinued. It is metabolized primarily in hepatic. The drug is excreted 85% in urine and 5% in feces.
For the indication, I am a powerful thrombolytic agent used in the lysis of acute thromboembolism. FDA-approved indications of me includes pulmonary embolism.
It is contraindicated in patients with history of intracranial hemorrhage, suspected subarachnoid hemorrhage, seizure at the onset of CVA, active internal bleeding, intracranial neoplasm, and arteriovenous malformation, aneurysm, and severe uncontrolled hypertension. It is also contraindicated in patients with a history of CVA within 2 months, intraspinal or intracranial trauma or surgery, or bleeding diathesis.
For the side and adverse effects, I am categorized per body system. First, for central nervous system, I can cause dizziness. For cardiovascular system, I can cause low blood pressure or hypotension, bleeding, and nosebleed. For integumentary system, I can cause allergic reactions like swelling, rash, hives, and also bruising. For urinary and reproductive system, I can cause genitourinary bleeding. For digestive system, I can cause nausea, vomiting, and gastrointestinal bleeding.
Nursing responsibilities during therapy with Activase. First, you have to perform neurological assessment and monitor vital signs every 15 minutes during the 1-hour infusion. Check for major or minor bleeding. Monitor for the sign of intracranial hemorrhage or orolingual angioedema. Nursing responsibilities after therapy with Activase. Continue to monitor for neurologic deterioration every 15 minutes for the first hours after cessation of infusion. Every 30 minutes for the next 6 hours. Every hour from the 8th post-infusion hour until 24 hours after infusion is stopped. Continue to check for major and or minor bleeding. Continue to monitor and control blood pressure.
Hello everyone, so for today we're gonna talk about me. So I am Reteplase and my generic name is Reteplase.
The brand name of the Reteplase is Reteplase. The Reteplase therapeutic is thrombolytic enzyme.
For the pharmacologic drug classification, I am a non-glycosylated deletion mutein of tissue plasminogen activator or TPA containing the Kringle2 and the protease domain of humans.
The drug is categorized as C. Same with the Alteplase.
For the mechanism of action, I bind to fibrin-rich clots via the fibronectin finger-like domain and the Kringle2 domain.
The pharmacokinetics of the Reteplase. It is absorbed and administered through intravenous medication, distributed through plasma metabolized by the liver and kidney, and excreted through urine and feces.
For the indications, I am used in acute ST elevation myocardial infarction or STEMI to reduce the risk of death and heart failure.
Reteplase is contraindicated in patients with history of CVA, active internal bleeding, bleeding diathesis, recent intracranial or intraspinal surgery or trauma, severe uncontrolled hypertension, intracranial neoplasm, arteriovenous malformation, or aneurysm.
For side and adverse effects, I am categorized per body system. First, in the central nervous system, I can cause dizziness and nausea. For cardiovascular system, I can cause bleeding. For the integumentary system, I can cause injection site bleeding. For the urinary system, I can cause blood in the urine. For the digestive system, I can cause vomiting of blood or vomit that looks like coffee grounds. For the immune system, I can cause fever.
Nursing responsibilities in administering Reteplase. Screen patient carefully for possible contraindication prior to fibrinolytic therapy. Flush IV line with 30 ml normal saline prior to and after administering the IV push. Be certain to give IV bolus slowly over 2 minutes. Continuously monitor patient during therapy for signs of hemorrhage. Avoid any invasive procedures that might provoke hemorrhage. Do not give any injections, draw blood specimens, or perform any other form of venipuncture during fibrinolytic therapy. Do not use non-invasive blood pressure monitoring on the patient.